Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Yes, we're your Health Talk hosts. I'm Jim. She's Kay. Good morning.
Good morning, James.
And with us in the studio this morning is Dr. Monique Gingold, a pediatric neurologist. And today we're going to be talking about neurofeedback or brainwave training. So, pediatric, that's children or babies.
Correct.
And so are we measuring the brain waves of children?
Actually, we're not measuring per se. We're training the brain to function better. And in order to do so, whatever area we were interested in training, we simply apply a couple of electrodes to the brain, just stick them on the brain. And I request the brain to function at a low brainwave frequency in that area that we want to train. And the child, or this is also available for adults, the individual who's hooked up, then once their brain cooperates and generates those right brain waves, they enhance the function of the brain in that area. And the way the person knows that they're doing well is they're hooked up to a screen and there's a video game or a movie, and once that video game runs fast or the movie screen is full and large, or we get rid of the pixels we apply on the screen when they're not doing well, the screen or the game works well. They also hold a bear that vibrates, so the more vibration, the better they're doing. And the music or the volume of the movie plays louder.
Why does this sound like fun to me? Is it because you're making it sound like fun?
It actually is fun. And, even when we have the most uncooperative patient, such as some of my autistic individuals, we may have to literally hold them in the chair the first session, and then they come back the second session bounding up the stairs, sitting down, willing to play because they feel good afterwards.
So this, you mentioned autistic children would be beneficial to have this
much.
Kind of training in the brain. What kind of training? I know that autistic children have trouble socializing, among other things. I mean, so are you applying certain parts of the brain for training?
So with the autistic individual, whether they're high-functioning, bright teenagers or some of my 3-4-year-olds who aren't speaking, we generally want to train the right side of the brain. That part of the brain is typically, the brain waves, everything is very high frequency, high energy. We need to calm that side of the brain, front or back. And we apply the electrode to that part of the brain, and they have been the best responders to the therapy.
There's an article in the Dominion Post from, I guess, a couple of years ago. Gingold brings neurofeedback to West Virginia. So this must be new for our area. It
actually is. I believe there might be at the university, the student center, they may be doing it for ADHD. And just recently, the Academy of Pediatrics elevated neurofeedback to a level 1 therapy for treating attention deficit disorder, ADHD. And this is looking at all the evidence-based research. So this is actually quite large, quite a big step. And they use functional MRI scan studies, and they found that it really is very helpful. I think this is exciting news, especially because this may convince insurance companies to cover neurofeedback, because right now they don't.
So you're getting the brain to function better. Is that
Correct.
what we're doing?
Yes, we are.
Is it a cure of any type?
Is it a cure? It improves a lot. It's hard to claim a cure for anything. I don't think anyone is ever really cured of autism. For example, they may function perfectly, but they're always going to have some little quirks. But I think back one of my adolescents who had very difficulty in social environments. She's now a cheerleader. She's participating in so many things, but she still has days where she gets bothered by things, but she functions beautifully.
Some of the medication that these children take have side effects. Will this eliminate medications?
I've had individuals who have come off their medicines for attention deficit. I've had many who have had their doses decreased. We have a computer based test for attention deficit in the order. That's the only FDA-approved test for ADHD. So that's why I invested in that. When I first started meetings a couple years ago, they didn't have any good data, and I didn't buy it. But now there's such good data that I have this test. So this enables me to measure a before and after effect of the neurofeedback. And we clearly see improvement in impulsivity and attention. And based on that, and based on the function in school, we're able to lower doses of medicine.
After we leave you, do we then do our own studies? Do we then try to keep rolling with what you've taught us, or do we have to continue to come back to you?
That's a good question. Most individuals who are training for migraines or for attention deficit or for peak performance enhancement, they generally are done. And then the autistic individuals, depending on their level of function, may want to continue or come back for refresher courses here and there.
I thought it was interesting also, and if we can go into the adults just a little bit, in that it can help with, well, I know children have anxieties as well, but depression and other things that we wouldn't think about, that it would be able to help.
Definitely. Migraines. They're using it for athletes, actually. And I had WVU's PhD for the psychology athletic department come by, and they were very interested. And there is similar but a different name program that's being used for athletes. And it's used, I believe that is available in Pittsburgh, and that's probably the closest neurofeedback area. But they have found athletes improve their ability, their function, their concentration. And the name of who was Ed, our rifle.
Oh, Cecil?
Yes. He came by with his team, but he was telling me that some of these shooters have actually improved their accuracy.
Interesting.
Now, what about post-traumatic stress disorder? A lot of veterans come back with that more and more all the time. Is this able to help them?
Definitely. And the way they are helped is by doing neurofeedback. And once someone completes a session, there's a deeper level of neurofeedback called alpha theta training. And that's what's been really helpful with the post-traumatic stress individuals. And this is being used now in government centers. Alpha theta is where speakers are put on, music is played, and when the brain goes into a deep concentration mode, they hear superimposed music, raindrops, other sounds. What they found happens is memories bubble to the surface, not causing stress, but just deeply rooted memories come up, and actually has been shown to be very helpful for the veterans or anyone with post-traumatic stress disorder.
Dr. Monique Gingold is our guest this morning. Tell us about your daughter, Naomi. When you first got this, was she your first... Well, I don't want to say experiment, but I mean, first patient?
Well, actually, she was. But let me just tell you, when I put it on myself when I was doing training, they hooked me up, and then I was driving this spaceship in a tunnel with music and colors, and I thought, well, this is ridiculous. I'm not really making this go. And I turned to speak to my partner, and the spaceship spun around, and the screen went black. And when I looked back, it was very hard to get it to go again. So yes, my daughter was studying for her GRE, and I thought, well, let's just hook her up a bit. She didn't complete the full course, and I didn't want to say anything to her. But when we were driving home after the very first session, she said, oh, look at those cute little trees and houses there. I never noticed those before. So she seemed much more focused. And her friends actually commented to her that she seemed calmer and more focused.
Did she have anxiety to begin with?
She has. She's a very high-functioning, stressed individual. But
her mom's not?
No, of course not.
Okay.
You want to blame me for this now. People have done that. So and what was interesting is in order to perform, to get the game to play, she tried taking deep breaths and relaxing, and nothing happened. We found that by me asking her some complicated vocabulary words, which she was studying for the GRE, that's when the game went. And there was a book called the ADD, the 20-Hour Solution, which applies neurofeedback. They were talking to very bright kids, and one boy says, oh, I know how this works. You have to take 20 multiplied by 6, divided by 4, and add 7. Then it works. So basically, by focusing, he was getting the game to work, and that's how it seems to work best.
How are you able to get information from the brain waves or the electrical activity? Are we wearing a helmet? Are you putting those little stickers on our forehead? How does that work?
Well, the stickers, there are 3 stickers, 2 that are on the area we want to train, and 1 that's a ground that goes on the forehead. And then it's hooked up to a computer screen, and that's where I set the frequency which we want the brain to generate. And we can see actually if there's more muscle tension, and we can, in the computer then, when the brain waves are in the right range, that's when the video game moves, the volume gets louder of the music, and the bear vibrates more.
Any hair clipping or anything to get those in the right side of the brain?
No, and we don't have to shave to remove the hair either.
Just
Okay.
a real quick question, because something's just come into my mind, and it's concerning. I know we don't want to get off the track too much about the age, but what about seniors that have dementia or perhaps Alzheimer's? In time, could this be something perhaps that would assist in that?
Well, I haven't dealt with the elderly myself, but in the meetings there are people who are working with them, and they're finding some improvement.
Wow, that's encouraging. It
It
is.
is.
I'd like to hear from somebody who's experienced the video game playing of neurofeedback. That would be awesome. I'd like to hear your experience. And
I think you should go try it, Jim.
it
Yeah.
sounds like I
It
would
would
have
be
fun
right up
doing
your
that.
alley. Yeah.
Peak performance enhancement.
Yes,
It's
that's
been
right.
used for
I
that.
need that. We all need performance enhancement, don't we? It's 8:45. You're listening to Health Talk, brought to you by Mon General on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Dr. Monique Gingold is our guest this morning, and we're talking about neurofeedback this morning, which is a holistic approach, and oftentimes people can reduce their use of medicine with this, but again, it's not intended to diagnose or completely cure any condition, correct?
Correct.
What is it intended for?
It's intended to improve function, improve function and decrease headaches if headaches are an issue. So I guess improving function in that respect, improving function. There have been corporate individuals who want to come in for peak performance enhancement. It improves the focus. They've used it with students studying music. In London, there was a study showing that they gained their skills, improved much more rapidly. It's been used for many areas. Attention deficit we touched upon.
So
now,
a tr-
Jim, just one thing. Jim said he might be interested. But the thing is, this can make you kind of sleepy, get you too relaxed. Think you're going to be able to keep Jim awake for this whole thing? Does it? It does make you relax a lot, doesn't it?
It makes you relax, but you have to stay awake for
You
this.
have to stay awake.
I can
Yes.
do that.
All right.
But I mean, I wouldn't mind having certain parts of my brain function better. I couldn't tell you exactly what those functions would be, though.
So what we first do is the first visit, we have a lengthy discussion, go over many things, and then targets the areas you want to improve or to address.
All right, now
I'm
here's
sure
the
we
thing.
could find something.
Here, the one thing that pops into my mind is my wife says she told me something, or Kay says she told me something, and I don't remember them telling me something. So am I not hearing well enough? Is that a function of the
Not
brain?
interested enough. I think that might be the
And
point.
also it's your gender.
Yes,
Yeah,
there you
okay.
go.
problem.
Thank
You
you.
can't work on that, probably, I guess.
No, you don't want me to work on that.
All women have tried, but we failed.
So patients participate in 2 sessions a week for how many weeks?
Generally, we require 20 sessions. And it should be 2 sessions a week initially to really get things going. Towards the end, we can spread it out to once a week, but no less than that.
And so you're going to determine our attention and focus.
Yes.
Okay, and this is part of the initial session, about 30-minute session with you.
Well, the initial session is a couple of hours.
Okay.
We talk a lot. You perform the quotient test, which is one that looks at your attention, impulse, focus. And then we do the training, and we show you in the first session, we show you the various feedback you can receive, you can work with. One is, remember the old game Pong? Pong is one of the feedbacks you could have. Another one is rollerball, where the ball just rolls across the street, uncovering a picture. Music gets louder, so that's another gentle feedback. Then we have a jet ski game. There's a car racing game. There's a spaceship that travels through tunnels. And also, you can simply bring in a movie or watch one of our movies.
I have a task that I do every day.
Okay.
But if something comes in and throws a curveball at me, like I take a phone call while I'm trying to do my task, I lose track of the task because of the phone call. Can this help me try to focus on doing 2 things at once, or are we talking about one thing?
It's going to just simply improve your overall focus and concentration. If that means being able to handle 2 tasks, then that should be improved as well.
So where does this go? Is this been around for a while, and what's the end result? What do you hope for?
So we hope to improve whatever that we've targeted initially, whether it's attention focus, migraines. With my autistic kids, sometimes it was parents they request better language, calming, less anger outbursts. We have a young man we're working with now who's actually bright, but he's quite involved in terms of autism. He's 15 and he bites, he can be aggressive. And lately, and he's only completed maybe 6-7 sessions, he's been calmer. When he's gotten angry, he's able to self-regulate, hasn't had any...
What do you mean by self-regulate?
He's able to, instead of escalating to the point of biting, throwing things, his mother says she can talk to him and get him to calm down. He's able to calm himself.
Almost sounds like it could help people with bipolar disorder as well.
I haven't dealt with that, but that's an interesting thought.
A mood swings?
Yes, definitely.
It helps people with mood swings?
Yes.
I think more importantly, too, all of these things for children, but for adults, and the depression angle of that, and also migraines, because we've never had a cure for migraines. Again, we know this is not a cure, but it can certainly put us on the right track.
Yes.
And we like the fact that we're not going to be under a lot of heavy medications.
Right.
And I'm sure you stress that.
Definitely. And, when I deal with migraines, I have a lot of patients with migraines. I also look at environmental triggers, and I find that if I get people off their caffeine, sleeping regular hours, better hydrated, not skipping meals, and exercising.
There we go back. See, we never get through a show without good nutrition and exercise.
And that tremendously improves the migraines, the incidence, the severity.
Anything about smoking? We didn't get that thrown in on it
right,
yet.
So definitely smoking. I don't bring that up as often because my migraine patients tend to be children, but a lot of teenagers, and smoking is or can be an issue there.
Yeah.
You mentioned that video games can include vehicles, nature, and animals. And when I think of animals, I'm thinking a video of me petting a dog sure would calm me, because they say that, in nursing homes and people that dogs and cats really, petting them and everything really calms people down.
It does, lowers blood pressure, anxiety. And actually, I have my dog who comes to work with me. He's a therapy dog.
Really?
So everyone always wants, especially, to come in the room, and he is calming. Just watching him is calming.
You ever hooked up your dog to
Excuse
a video?
Me?
You ever...
No, but what an interesting thought.
You just gave her an idea.
Yeah.
See?
We can read the dog's brain. I'm pretty sure he just wants to eat more. We'll be back in just a moment. Dr. Monique Gingold is our guest. You're listening to Health Talk on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Mr. Bill from Mon General brought us a great topic today. Good job, Bill. Monique Gingold, Pediatric Neurologist. Neurofeedback is the topic. And so after this show's over and you go back to your office, our listeners are left with wanting to learn more. What do they do? Where do they go?
A good site to look at on the internet is EEGinfo, EEGINFO.com. And there are 3 or 4 different levels, or not levels, but programs in the country doing neurofeedback. And I chose to study with these people because they have the most scientific evidence, and their training differs, the location of the electrodes differs on the brain. So that's whom I studied with. They have a wonderful site. People can also call the office at 599-5500. We have a wonderful neurofeedback brochure with a DVD if they're interested.
Well, you seem to really enjoy what you're doing, so you must see a lot of positive results from this.
Definitely. It's not 100%, but in the low 90%, which is quite high.
All right. Again, your office is located in Star City, and your telephone number is?
599-5500.
All right. Neurofeedback is direct training of brain function by which the brain learns to function more efficiently. I think everybody's probably eligible for this, or should be, or could be.
Definitely. Adults and children.
All right. Thank you so much for being on the program today.
Thank you for having me.